Yeah, that's crazy.
Yeah, it is so do that. Okay.
All right. You good? Good? Did you get enough out of this practice?
I am. I'm getting that.
Awesome. Okay, everyone. How's it going? Everybody good? Take a minute to finish up what you're doing and come back in the room so we can keep going. Well, how did that go? Everybody, how did it go? Did it go well? Do you have questions? Yes.
So, for these steps, before break state, what do you do with your bad hand? Do you let it like relax?
Sorry, before breaking the state.
Yeah, breaking the state. Like when you just
Sure.
transfer this bad energy in one hand, and then you have to like take their mind over.
Gotcha.
What do you do with the hand?
Yeah, so the question is, what do you do with the bad hand when you're done with it?
Yeah.
Is that right?
Yeah, and then you have to break state.
Oh, for the break state. Okay, so you're building the anchor, right? You're telling them every time you close this fist, you're gonna feel that. Then you say, now relax your hand and let go of all those feelings.
And then you ask about lunch.
Yeah, relax your hand, let go of all those feelings, and tell me, what did you eat for lunch yesterday? Or whatever that is. Yeah, whatever the break state works for you.
So
that one works for me so easily, so I just use it all the time. But
and the same with the right hand.
yeah, well, once you do that, then you go to the right hand, and then when you let it go, yeah, you want to make sure both hands are like this when you start the collapse. So as you build this anchor, yeah, every time you close that fist, you're gonna feel these feelings. Great. Okay, you're feeling them now? Yes. Okay, awesome. So take a nice deep breath and exhale and let go of that hand. Just relax. Awesome. Now, in a moment, I'm gonna count from 1 to 3. When I get to 3, yeah. So you just move on to the next thing. It's quickly. We're building. Okay, we're done with it. Next. Is that clear? The timing and stuff. Any other questions about the technique? Did you all get to be both parts, the hypnotist and the subject, to kind of say the things and notice what it was weird? It's like, oh, that didn't feel right. Yeah, did you stick your foot in your mouth a couple of times? Maybe saying some things? That's okay. That's what we practice. It's a language. Any other questions about this technique? No? Cool. Let's see. We have 35 minutes. I have time to go through another technique and dissect it probably to a minor level, and then let you guys go and make a hole through the world with these techniques. So who would like to change something that they're feeling, a pain, a fear, anything that is, of course, not a medical pain that needs to be checked out before, but anything, emotions, fears, pains, whatever. Bring it on. I was gonna suggest that you would come, but I didn't want to do that. I wanted you to come out. So yeah, come on in. You want yeah. All right, give a round of applause. Awesome. Okay. So this technique, if you have. There's a handout that looks a little different, more blue. If you have that, it's the same. I just got to reprint it with a little different colors. This technique is called pain as an object, and it's right there on the technique cheat sheet. So you can kind of follow along. I think the one thing I missed there is rating it. We're going to do... So in the middle of that technique cheat sheet, you see a technique called pain as an object. Again, this is a technique you can use for helping a person relieve something. X, Y, or Z. It could be anger, it could be fear, it could be pain of anything. It could be a combination of things. Oh, you have a lot of fears regarding dentistry. It's not just the hand piece, the drill. It's not just the drill, the shot, and the finances. Well, sit down and let's do this. And it's, again, there's a feeling, a general feeling that we can work with. Okay? The reason this technique works is because we get into it and we create something that's not there out of this feeling. So what I'm going to ask her to do in just a moment is find that feeling inside of her, yeah? Identify the source. For most people, it's usually the stomach, the chest, the throat. Negative feelings are generally kind of like living there. But some people might feel differently, that's okay. Just ask, where in your body do you feel those feelings? I'm going to ask her to identify it. She'll be like, oh, it's right here in my chest, okay. When you feel those feelings in your chest, imagine your hand is a magnet and your feelings are a magnet and they're getting stuck together, so that when you pull your hand out in front of you like this, those feelings are in your hand and they can no longer bother you inside. So I'm going to ask her to think about some feelings and pull them out here and be like, oh yeah, I see them right there. They can't bother me in here while they're out there. Then I'm going to ask her to give those feelings some features. A shape, a color, a texture, a temperature. Yeah? And then once that's no longer a feeling, once that's an object, then we're going to change the features of that object and put it back. Because the person's mind has created this object. The person's mind has said, their unconscious has said, yep, this negative feeling feels like a square, like a cube. Feels hot, feels like sandpaper. And then all those features that that person has given to this symbol are what she thinks of that. Yeah, what this person thinks of those feelings. That's what those feelings represent to me. So then when we change those feelings to other feelings, a set of feelings that feels good for the person, then it's kind of like the scrambling of the techniques. Like, well, those feelings meant that, but now they're different. Now I've changed that to a ball that's red and it's cold and they're different. So when you put it back, they're a little different, okay? So, without further ado, let me just go through the technique and then we'll get questions in more details. So, Susan. Hi. You don't have to tell me exactly what it is.
Okay.
So that we don't spend a lot of time on therapy before that.
Exactly.
This is why I'm teaching you these specific techniques, is because you can actually make these techniques a 5 to 10 minute thing. And if you have a patient who is extremely anxious about needles or whatever it is, if she comes to your office, what do you think is worth your time more? To spend 10 minutes now and help her go from a 15 to a 0 and then have treatment anytime she wants? Or to fight with the fear for 30 minutes and try to get it done quicker? Right? It's better to just, okay, let's just hone into this for a minute. I know we may be 10 minutes behind, but then we're gonna, things are gonna be so much easier. So maybe the work you would have done in the hour, you can do in 25 minutes if you know that she's already relaxed. Okay, so just think about that. And in the investment of time on having a very good relaxed patient versus just a patient, or a patient who is, on the other side of relaxed and, like having to be tied down in some way. Okay, so.
Sorry.
Oh no, that's okay. That's okay. I just want to. I'm okay with phones ringing. I just don't want to ring while it's exactly wrong.
Exactly.
Okay, so these feelings, you don't have to tell me exactly what they are. We already talked a little bit about it. That's maybe some anger, right? Some feelings. This could work for a lot of things.
Yeah, there may be some underlying fear confrontational fear,
okay. Yeah, fair enough.
Frustration and anger. And we all had, if you've been a retail or patient, you ever had an irritable patient who's been upset and unreasonable and they're just way out on the other side of the world. You've had those patients, right? I mean, we've all had those patients, customers, clients, and workers and bosses and whatever. So let's just put that in a nutshell.
Okay, excellent. So you have some conflict that you like to deal with, some
Correct.
confrontation that maybe doesn't have to turn into confrontation, but if you were to just feel better about it and be able to let the feelings kind of slide a little bit more, it would be better for you, right?
Yes.
You would feel better for yourself. So
yes.
Awesome. Do you have a sense of all those feelings in one spot in your body?
From here all the way down to my shoulder, my wrist, my shoulder, my back.
Okay.
And I feel like I'm like this.
Wow, okay.
Walking around like this.
So this is somebody who's
Rocking
actually
my sleep,
carrying
my
the
peace,
weight of
my
those
having
feelings,
my
right? I mean,
family.
she's like hurting, physically
robs me of
receiving.
my happiness, my freedom,
Right. Okay.
my time with family. It's a robber, like a thief.
Yeah. Well, nobody likes thieves. Are you ready to get rid of that?
I am.
Okay, well, let's do it. So those feelings, obviously, this is a large area, but is there a place where it's stronger? Maybe.
Right here on the
Wrist?
shoulder. Like someone's
Okay.
got their hand right here,
Like
gripping.
Grabbing you, holding you down.
Yes.
Okay. Perfect. Perfect for the exercise. So go ahead and put your hand there, like that, and just leave it there for a moment, knowing that that hand is a magnet for these feelings. And imagine if you could give those feelings a color. What color would they be?
Blonde.
I'm sorry?
Yellow.
Yellow. So blonde, like a blonde yellow. I wasn't sure if that's
Sure.
what it is. Okay, so we have these blonde colors. This yellow feeling right there in your hand.
You got it.
We got a lot of blondes here.
A lot of ones. We're just gonna call it yellow if that's okay with
Yellow.
you.
Yellow.
That sounds better.
All right. Because we're not supposed to be laughing. This is not supposed to be fun.
Okay.
It's a seminar. You're supposed to be learning.